It's another day with the physicians where your health is our business.
With growth spot the end. So you are not going to take some drastic measures. But a 10-year-old coming, pressure is high. But also to know that it's not only when your pressure is high that you have glaucoma.
Sugar, and I don't know about any other one, but what you know,
You're welcome back to the training also of your regular program.
I used to have a lot of pain crisis as a child or even in my teenage years.
Pneumonia is a form of acute respiratory infection that affects the lungs. It is caused by bacteria, viruses, or fungi. The lungs are made up of small sacs called alveoli, which fill with air when a healthy person breathes. When an individual has pneumonia, the immune system's reaction to this infection causes the lungs' air sacs, also known as the alveoli, to be filled with pus and fluids, which makes breathing painful and limits oxygen intake. According to the World Health Organization report, pneumonia is the single largest infectious cause of death in children worldwide. Pneumonia killed 740,180 children under the age of 5 in 2019, accounting for 14% of all deaths of children under 5 years old, but 20% of all deaths in children aged 1 to 5. Pneumonia affects children and families everywhere, but deaths are highest in South Asia and Sub-Saharan Africa. On your regular health TV talk show, The Physicians, we will be discussing pneumonia, the risk factors, the causes, the symptoms, diagnosis, treatment, and of course, prevention. Stay tuned. It's another day with the physicians where your health is our business. Today we'll be discussing pneumonia, the risk factors, the causes, symptoms, diagnosis, management, and of course prevention. My name is Dr. Martina Agbere, your usual anchor on this program. And as usual, I have my co-host with me,
Dr. Memuna Yusuf Kadri. You're welcome on your favorite health TV talk show where your health is our business.
always our business. We're going to be discussing pneumonia today. And I remember just before we started, I told you I had pneumonia.
Yeah.
I don't think you've ever had it before.
Never had pneumonia.
Pneumonia, it is not something that you pray for. I had pneumonia when I was in secondary school, precisely my Form 1. Then I didn't know it was pneumonia. I just knew I had this difficulty in breathing. It became so bad that when you take the breath, you ask that God should just sustain you until you have another breath. I was breathing, but the breath wasn't really getting to my lungs. It was like it was suspended. And had no idea what it was. Of course, secondary school, they took me to the sick bay until they had to take me to the hospital. After the initial investigations, and they came and said I had a pneumonia. Well, some people, you have pneumonia, you probably, you took too much cold water, you have
Those are the issues with pneumonia.
Yes.
Those are beliefs that are still ongoing.
Of course, when the gas comes in,
AC.
don't AC, don't chew ice, don't chew block,
Ice.
ice.
Chew block.
Yes.
When I'm pregnant like this, it's me and ice block.
But then where did all this really come from? What is myth? People just
That's
feel
why
it.
we have
They say
the-
you have to wear cardigan. Don't expose yourself.
Yes. You know, that one to an extent is even very logical. You know, if you are cold, if you feel cold, you can. But it's not anything related to all this because now we are knowing that it's a bacterial virus and infection.
Of course, bacterial
so
virus and fungal infection. So which means it has to actually do with your even your environment.
Yeah, that's what I'm saying.
Overcrowding.
Yeah,
and I'm sure it will be more in the low income
on the self communities,
even the countries, third world countries
like us.
Hello, don't even go there. We'll be back after the short break. Stay tuned. We'll be discussing pneumonia, the risk factors, the causes, the symptoms, diagnosis, management, and prevention. Stay tuned. Welcome back to your regular TV health talk show, The Physicians, where your health is our business. Today we'll be discussing pneumonia, the risk factors, the causes, the diagnosis, treatments, and possible complication. In the studio with me, we have a guest. She is a respiratory physician. She is a member of the Medical Women Association of Nigeria. She's also a senior registrar, pulmonary subspecialty at the Department of Medicine, the Lagos State University Teaching Hospital. She's also a member of the Nigerian Thoracic Society, the Pan-African Thoracic Society, the European Respiratory Society, American Thoracic Society. In fact, her CV is just so long. Join me in welcoming our guests, Dr. Temitope Fapohunda. Our guests, very elegant guests. Welcome to our program.
Thank you, ma.
You're welcome. Hello,
Thank you.
glamorous.
So you are going to just talk like a respiratory physician so that my audience can hear you out there. Yeah. So we're going to talk about pneumonia, okay? The risk factors, the possible the causes, the symptoms. You want to just give us a general overview of the lungs? Just tell us a general overview of the lungs, the location, and where this infection affects, where it affects. Then before we now talk about the symptoms and the presentation and things.
Okay, so in simple terms, the respiratory system, the major function is in adding oxygen to blood. We all know, we hear the term that blood is life, but actually it's actually oxygen that is life.
Okay.
But blood carries the oxygen. So the respiratory system is made up of the lungs and the airways or the pipes. So when we talk about pneumonia, pneumonia has to do with infection involving the lungs itself. Now the lungs is the organ, they are like two bags of air that their job is to add oxygen to blood and also to release carbon dioxide, which is the waste from the body. So that is the job of the lungs.
Okay.
So pneumonia is when there's an infection in the lungs, and in that process it impairs the function of the lung in carrying out its major duty of providing oxygen to the body.
Okay.
So that's one.
So it's an infection that takes place in the lungs. So which means it has nothing to do with taking of cold water, exposing yourself to AC and all those myths. So you want to tell us the main causes of pneumonia?
So sometimes there may be a little bit of truth in some of the so-called myths,
Okay.
actually.
Okay.
Okay, so for the main causes of pneumonia, first of all, pneumonia is an infection. So it's caused by an infectious agent, which could be a bacteria or a virus. We're all aware of COVID virus, then fungal organisms as well. That is the cause.
Okay.
Now, risk factors. Normally, the lungs, the airways, the human body, we have mechanisms to protect us from coming down with the infection, even when we're exposed to these organisms. So the risk factors are things that reduce this protective function of the lungs and then make the individual become susceptible to those organisms. So these are what risk factors are. So usually people at the extremes of age, so the under 5s and the elderly individuals are at risk. And pneumonia is one of the top killers of under 5 children, especially in low middle income countries. And so that's one of the major risk factors. Other risk factors have to do with smoking. Smoking is an important risk factor. Other risk factors have to do with some environmental conditions, overcrowding, air pollution, because when there are pollutants in the air, they contribute to reducing the immunity of the airway, so that's a risk for pneumonia. And then people that have background respiratory problems, people that have asthma, COPD, people that have heart failure, other medical conditions, kidney disease, diabetes, because these conditions have a way of reducing the overall immunity of the individual, so predisposing to pneumonia. So just to dispel the myth a little bit about AC and cold. So I said there's some truth. So there are some, when it comes to the AC, it has filter. So sometimes the filter system may be contaminated with some organisms.
Okay.
There's a particular organism, it's called Legionella, that you see it in people that went on holiday or vacation and they stayed in a hotel, or they were in a cruise ship, somewhere where they were exposed to ACs or cold, and then it came down with pneumonia. So it could be the reason where some of the myths came from, but it was still an organism that was in the AC vents that the person got exposed to. Then for cold generally, now cold air has a way of reducing the flow of air. The natural reaction of the body, the airways, is to close a little bit when you're exposed to cold air. So because when we breathe in, our nose adds some moisture and warmth to the air. So in people that have background lung problems, especially asthma patients now, so if they're exposed to the cold, there could be an exaggerated response of the asthma symptoms, preventing airflow, and then organisms can now accumulate and then cause infection. But one important thing I want everybody to know is that the commonest source of these organisms is actually from our mouth. Everybody, to an extent, we aspirate a little bit of our oral secretions, especially when we sleep. And it is from these organisms we have normal flora in our mouth, some strep. The commonest bacteria that causes pneumonia is Streptococcus pneumoniae, and it is present in the oral cavity. So most people, it is from the mouth that this organism gets into the lungs. So that is the major roots of infection.
So let's look at how is this transmitted? What did doctor say? Mode of transmission, and what are the signs and symptoms? What should people look out for? I don't want to get to that stage like what she described, and then have that difficulty. Some people may not even survive it. So I want us, for our viewers, to understand this.
Okay, so the mode of transmission is, it depends on the infectious agent. So for viral pneumonias, generally the most common agent was actually the flu, influenza, before the advent of COVID. So viruses generally, they are transmitted by aerosols or droplets from an infected person who sneezes or coughs or even talks, and then someone else comes in contact and then gets infected. However, the risk of the person getting infected is also related to the person's immunity. So people that have strong immunity, that's why children are vaccinated, they may come in contact with an infected person and not come down. Usually people that have some medical comorbidities like diabetes, heart failure, stroke, other comorbidities, HIV, those are things that increase the risk of an individual getting infected from exposure to viruses. Now for bacterial pneumonia, it is actually organisms from the mouth that the person aspirated during sleep, got into the lungs, and then also as a result of the person's depressed immunity, the organism thrived and led to pneumonia. So this could be in the community and then or in the hospital setting. So but it is from organisms that get into the mouth for bacterial pneumonia. For fungal organisms, they do not typically cause pneumonia in healthy people with healthy lungs.
Okay.
Usually people that have damaged lungs, maybe an individual that had TB in the past, that has some scars in the lungs, usually those are the kind of people that
Like
come down
immunocompromised
with
people?
fungal, immunocompromised people, HIV, people nowadays, people get organ transplants and they are on some drugs to suppress their immunity. Yes, those are the kind of people that get fungal pneumonias.
Okay. You've talked about the mode of transmission, and she did ask about the symptoms.
The symptoms.
How do they present?
Now, there are no classical symptoms for pneumonia, but the common thing, the most common symptom is cough, fever, usually a very acute onset. The person feels unwell. There could be some chest pain. Then there could be some difficulty breathing. So these are the typical symptoms of pneumonia. However, these are the typical symptoms of any other thing going on in the lungs or even in the heart. So usually if one is experiencing those symptoms, the best thing is to seek healthcare at the healthcare facility where they would most likely request for a chest x-ray. So for a pneumonia, usually there should be an abnormal area in the lungs on a chest x-ray to say this is a pneumonia. Usually that is necessary.
So it's actually very scary. When we come back from break, we'll go straight into the management, how it can be managed. We need to keep a date with the physicians. We'll be talking about pneumonia. Let's hear from you out there. Have you had pneumonia before? Or you've had somebody who had the pneumonia? Are you one of those who actually have always thought that cold water, AC, and of course exposing yourself to cold is a cause of pneumonia? We'll be back after this short break. Stay tuned.
Pneumonia is something caused through cold, anything cold.
Yeah, pneumonia is infection of the lungs and airways caused by the cold.
Pneumonia is anything that is caused by cold.
People have chest pain, gives body pain also.
Most times, I think pneumonia affects the ribs and the lungs.
No, not at all.
I've never had pneumonia before, but I think I once had a friend that experienced it before. And most times he complains about the ribs, pains in the ribs part.
No, yes, very much yes.
Obviously, yes.
Yes. It can cause sleeping under the AC, cold, taking cold things can actually cause pneumonia.
Welcome back. If you have just joined us, you're onto a regular program, The Physicians, where your health is our business. We've been discussing pneumonia, the risk factors, the causes, the symptoms, management, diagnosis, and of course we're going to talk about the prevention. And in the studio with me, our guest is Dr. Temitope Fapohunda. She is a senior registrar at the Lagos University Teaching Hospital, in pulmonary subspecialty, and a member of the Nigerian Thoracic Society, and of course a member of the Medical Women Association of Nigeria, Lagos State Branch. So now, how is it managed? How can one manage pneumonia after being diagnosed?
Okay, so the management can be from home with oral medications or in the hospital, depending on the severity. And like we said, it's an infection, so there will be use of some anti-infectious medications. So during the diagnosis, the likely organism may have been found from cultures, maybe from the sputum, that's what the person coughs out, or from blood, and then also the setting, like I mentioned. So if the person came back from a vacation, a trip, and then depending on the chest x-ray features, these are things that we put together to determine what likely organism. So we'll give a targeted drug. So for us to know, is it bacteria, is it viral, and then we'll give the appropriate antibiotics or supportive treatments in the case of viral pneumonias. So, but honing down on the bacterial pneumonias, because that is what is most common in children and in adults generally, we have some scores that we use to determine the severity. So if it is mild, usually we will give oral antibiotics and then some other things for the fever, the body aches, and then the individual can take the medications at home. And then if it is severe, it will require the person to be admitted, to have the medications given parenterally, and to have some other resuscitative treatments.
From what you have said, going back to the causes, bacterial, viral, and fungal infection, and we know in our time here, we know many people who think they have pneumonia. They just use antibiotics. So most times, of course, you will not have patients coming back and not being properly treated, because most likely it's likely to be a viral infection. So when they use such antibiotics, normal antibiotics, of course it will not be properly taken care of. So there's actually a challenge there. I think the viewers need to really understand that it's not every time that you have this cough that you must use antibiotics, because then we'll begin to have people that have antibiotic resistance. So now you talk about the diagnosis, the treatment. What are the possible complications?
Okay, so first of all, the lungs, like I mentioned, the respiratory system and the primary function. So one of the most important complications which COVID exposed the whole world to is respiratory failure, meaning that the individual now needs to be in the ICU and possibly requiring some assisted ventilation. That is the most scary and severe complication of pneumonia. And pneumonia is the #1 cause of respiratory failure. There are so many other causes, but pneumonia is the first. So, which is why when the diagnosis of pneumonia is made, we immediately assess the severity. Some patients from presentation actually need to be managed in the ICU to prevent that. So, which is why pneumonia is something that has to be diagnosed in the hospital. There's really no individual home treatments, and it's our environment. It's actually wrong to just use antibiotics when you feel like. It's important. Now, other complications could be from the pneumonia is an infection. The infection could spread to other parts of the body, to the bloodstream, known as sepsis, which could lead to other organ damages, kidney problem, the heart, bleeding. So it could become a full-blown systemic infection. Then some other complications of pneumonia could be from the symptoms as well, from the cough. Sometimes there could be coughing up of blood that could be life-threatening as well. So those are just some of the complications of pneumonia. And well, those are the acute. Long-term, especially when it's not properly treated, there could be some scarred areas in the lungs. Even in the immediate term, there could be like a collection of pus, known as a lung abscess, that can occur as a complication if the pneumonia is not well treated. They could develop fluid. The lungs are contained in a bag that helps to lubricate the lungs, and the bag usually contains very, very small amount of fluid, like less than 50 mils. So, but in pneumonia, if it's not well treated, that bag can accumulate a large volume of fluid that would also result in prolonged hospital stay, needing invasive surgical procedure, and can also contribute to the respiratory failure. So those are just some of the complications that can occur with pneumonia.
So I want to lay emphasis on what are these preventive tips, the strategies, what should people really do to ensure that, even if you even eventually then have pneumonia, it won't be like the severe form. So prevention.
Okay, so the prevention, we could explain it in terms of primary and secondary. So primary, before any individual has pneumonia. So for infections generally, one of the most important preventive strategies is hygiene. So good hygiene practices in the home, good hand washing practices, and then maintenance of even things like the fan, the ACs. A lot of times they gather dust and they keep blowing the dust, and then we inhale them. So it's important that the home is kept clean, including exposure to air pollution. So we should use clean cooking fuels, preferably gas. I mean, there are other cooking fuels like kerosene and wood and coal, that they release gases that contribute to air pollution, especially households that have little children. They are particularly at risk to those pollutants. So, and then other things like avoiding overcrowding, good ventilation in the house. So those are some hygiene practices. Then the next important thing is vaccination.
Wow.
So, which is why children under 5s, they are vaccinated against streptococcus pneumoniae, they are vaccinated against Haemophilus influenza. Those are the two commonest bacterial causes of pneumonia in children. And of course, with the advent of COVID, which is why everybody is encouraged to get COVID vaccination, because that has been shown to be the only most important way to prevent viral infections generally worldwide. So that's for primary prevention. Now, secondary prevention is in individuals that have also, coming down to adults, there are some other things. So I mentioned smoking. So stopping smoking is also an important strategy to prevent lung infections generally. So smoking cessation is important. Then in individuals that have symptoms of pneumonia, preventing complications. So it's important to present early for assessments at a healthcare facility, primary health center, secondary health center, and to comply with the treatments as much as possible. And these are ways in which to prevent complications from pneumonia.
Thank you very much, Dr. Fapohunda, and really appreciate your presence here today. And I'm sure when we call again, you'll please help us and respond. Because it's always a delight having people like you come on our program, the physicians. Thank you so much. On that note, I want to say thank you so much for keeping a date with us. I am Dr. Martina Agberian.
Don't forget to follow us on all our various social media platforms, Facebook, Twitter, Instagram, and all our previous episodes and our YouTube page. If you want to be part of the program, our website is up and running. Just send us an email. You're just a click away, and you just be like our amiable and beautiful guest right here. My name is Dr. Nemuna Yusuf Kadri. Till next time, remain blessed.